Welcome and peace be with you. This session of illness management, and the focus of this particular illness management is on the role of lifestyle factors in illness management. As mentioned previously in the Tibb principles of lifestyle factors, it was highlighted that lifestyle factors, if not adequately managed in accordance with an individual's temperament, are ultimately the cause or causes of most illness conditions. Also, in the Tibb principle of treatment in Tibb, it was elaborated that treatment is based on the concept of opposites with respect to both lifestyle factors and medication. Inclusion of suitable lifestyle factors can therefore add great value even when taking other medication from conventional or complementary modalities. This is because the Tibb lifestyle factors will assist not only in managing the symptoms but also addressing the causes of illness conditions. This was confirmed in a research conducted by the Institute where patients who were on conventional Western medication included the Tibb lifestyle factors in the management of their mostly chronic conditions. The positive outcome of the research provided sufficient proof that Tibb and Western medicine can be combined in an integrative model for the benefit of patients. While treatment in Tibb includes the use of natural or herbal medication with a focus on eliminating toxins through cupping, massage, and purgation, the primary focus of this discussion is based on the role of lifestyle factors in illness management. Now, the protocols of lifestyle factors in illness management offer simple and practical yet specific advice for each condition, whereas in Western medicine, a one-size-fits-all approach is advised when it comes to, say, diet, exercise, and other lifestyle factors. This is the big difference between Tibb, which is targeted, and where in Western medicine it is generic and a one-size-fits-all. Now, in this particular link, the protocol of managing 50 common illnesses from acne to varicose veins are listed from the Institute book, Healing with Tibb. While each of the 50 illness conditions are described, it is also interesting to note that the Tibb principles allow for greater detail in the diagnosis of illness conditions. For example, hypertension in Tibb is diagnosed in two different ways. Primary or resistant hypertension, where primary hypertension, also known as essential hypertension, is the result of increased blood volume requiring a diuretic in treatment, typical of the sanguinous hot and moist temperament, whereas resistance hypertension is a result of narrowing or hardening of arteries, typically associated with a melancholic, cold and dry temperament. Another example is headaches. Tibb identifies 4 types with in-depth understanding on the causes of each, detailed explanation on the signs and symptoms, as well as lifestyle treatment of all 4 types. Added to this is a correlation of headaches associated with the different temperaments. It also needs to be noticed, while the lifestyle protocol for each of the 50 illness conditions are described in relation to their associated qualities, with age and the possible development of multiple conditions, patients may sometimes present with illnesses of differing or even opposite qualities. For example, a sanguinous dominant individual may present with primary hypertension with cold and moist qualities, and also age-related osteoarthritis, which has cold and dry quality. This will invariably affect the lifestyle management protocol, especially diet. Fine-tuning of the lifestyle factors will need to be done under supervision of an experienced Tibb practitioner who will take into account the age of the patient as well as the humoral imbalance, necessitating a revised lifestyle protocol. An overview of each of the 50 illness conditions provides consumers with detailed understanding of the illness conditions in terms of causes and the management thereof. These include, firstly, a brief description of the illness, common signs and symptoms with possible complications that could develop if the illness condition is not effectively managed. The Tibb view on each illness, particularly in relation to the qualities associated with it. The role a person's temperament plays in the predisposition, onset, and progression of a particular illness. The rationale behind the Tibb lifestyle management protocol for specific illnesses, including dietary and other lifestyle advice. The use of practical herbal remedies. In our discussion today, we will focus on the role of lifestyle factors in the management of cold and flu, using this as an example. So let's talk about cold and flus. What is a cold? Common cold, also known as coryza, is an acute condition that affects only the upper respiratory tract, mainly the nose. It is the most common respiratory disorder in many parts of the world. What are the signs and symptoms of a cold? Runny nose with clear mucus, blocked nose, sneezing, sore throat, watery eyes, cough, headache sometimes, and slight fever sometimes. And let's talk about a flu. What is a flu? Flu or influenza is also an acute and contagious condition that affects the respiratory system. It is often confused with a common cold, but flu is more severe. Flu usually lasts for 1 to 2 weeks, but the complications can be longer lasting and more serious, especially with lung infections such as bronchitis and pneumonia. Now, what are the symptoms of flu? Fever and extreme coldness, chills, shivering, shaking, body aches, especially joints and throat, nasal congestion with yellow or green mucus, runny nose, cough, headache, fatigue, watery eyes, and diarrhea, which is usually with children. Now, what causes cold and flu? The common cold and flu are due to infection from certain viruses. Risk factors include exposure to cold and rainy weather and a weak immune system. Now, let's emphasize on the Tibb view on cold and flus. According to Tibb, cold and flus are associated with coldness with moistness, as they typically develop in cold months of the year. Symptomatically, cold and flu present with excessive mucus production, such as a runny or congested nose and a productive cough. Due to the weakened immune system, physis is unable to prevent this virus infection. But we all know physis is always actively fights in order to restore the body back to health within 3 to 5 days for a cold and 1 to 2 weeks for a flu. Although all temperamental types can be affected with cold and flu, people with a phlegmatic dominant and subdominant temperament are more at risk due to their innate qualities of coldness and moistness. Now let's look at the treatment and management of cold and flu from the Tibb perspective. Treatment and management is aimed at reducing the excess coldness with moistness associated with cold and flu by implementing lifestyle factors that will increase the qualities of heat and dryness. And this will obviously assist physis in addressing both the symptoms and the causes of cold and flus. Now let's look at each of the lifestyle factors and how it is implemented, bearing in mind that because cold and flus have got cold and moist qualities, all the lifestyle factors will be linked to opposite qualities of heat and dryness. So let's look at the first lifestyle factor, food and drink. The advice is eat mostly hot and dry foods such as chicken, oily fish, garlic, and onion, followed by hot and moist foods like flavored with spices like ginger, turmeric, and black pepper. Eat less cold and dry foods like the lemon, oranges, yogurt, and the least amount of cold and moist foods like milk, cucumber, and rice. All of these are ultimately the cause of the problem. Right? It's important to note that while some of the ingredients in the diet charts have been mentioned, but a direct link to the complete diet chart is accessible on the underlying hyperlink on the PDF document, which is there for every illness condition. Let's continue with food and drink. Avoid dairy products, margarine, fried food, and sugars. Avoid solid food for 3 days. This is to assist physis in the recovery process. Sup hot chicken, beef or mutton soup spiced with garlic, ginger, black pepper and salt for 3 days. Drink at least 2 liters of warm water per day. Other lifestyle factors, exercise for example, remain as active as possible unless you have a fever, in which case bed rest is strongly advised. If you talk about environmental air, avoid exposure to cold and wet weather, which is obviously the cause. Now let's talk a little bit about breathing. Use steam inhalations to promote drainage and ease pressure. Use a pot of hot water and add a few drops of eucalyptus or rosemary oil. Put your face over the pot and cover with a towel. Breathe in deeply. Do this several times a day for 5 or 10 minutes. And the lifestyle factor of elimination, massaging the chest and throat with a heating ointment such as Vicks or Puma Balm or Black Seed Rub to ease congestion, which will help to eliminate phlegm, which is ultimately the cause of the problem. Let's look at herbal remedies that are advised in the treatment of cold and flus. 2 grams of fenugreek seed, 1 gram of cinnamon, 1 gram cloves, 2 grams fresh ginger. Boil in 2 cups of water until 1 cup remains. Strain and mix in 2 teaspoons of honey and drink. Repeat the same 3 times a day. Ginger and honey tea. Grate 2 centimeter piece of ginger to a pot of 2 cups of water. Bring to boil, then add 1 teaspoon of honey. Drink it while it's still hot. Also note that the ingredients in the herbal remedies have heating qualities. Now, let's do an overview about the whole discussion that we've had. Having discussed cold and flu and the rationale that underpins the application of lifestyle factors in the management and treatment, there can be absolutely no doubt that integrating Tibb lifestyle factors in the management of any illness condition, be it acute or chronic, will enhance the recovery with an improved quality of life. And also, for information, the Institute's book, Healing with Tibb, as well as Cooking for Your Body Type, are both available for free download from the website. Finally, I am hopeful that the information provided in the YouTube videos has empowered you to take control of your health in the management of illness conditions.